So it looks like you have a bone spur, and that's causing your shoulder impingement. It looks like the actual bone spur is causing some irritation to the bursa, and it's tearing your rotator cuff. Ugh, that sounds really bad. And conventional wisdom says that you need to have surgery so that we can remove the bone spur and that will relieve the shoulder pain. But is that actually the case? Let's start off with taking a look at the anatomy. So here's my shoulder here. This is your clavicle, also called your collarbone, and then we also have the acromion process, which is part of your shoulder blade. That forms the AC joint right here, which when you separate your shoulder, that's the joint that you separate. And sometimes there can be a bone spur formation, which kind of hooks down into what's called the subacromial space. And in that space, you have a couple tissues, so you'll have your bursa, you'll have your rotator cuff muscles and tendons, and then you'll also have some ligaments in that area. And the thought of doing surgery for shoulder impingement is that that bone spur is causing irritation, and so you have to remove the bone spur to relieve the pain. But a recent study published in the Lancet, which is a medical journal, they looked at the effectiveness of these surgeries commonly used for shoulder impingement. And so this study included 313 people, and there were 3 different groups. There were 2 surgical groups. One of them was a subacromial decompression group, which in this group, that's the surgery that they typically perform for shoulder impingement. So what they do is they go in there, they shave the bone spur, they remove any of the tissues in there, and they also release one of the ligaments, which is your coracoacromial ligament, in the hopes of kind of just opening up that space so that you don't have impingement anymore, and therefore you don't have pain. The other surgical group was just an arthroscopy group. And what they did was, it looks like you have a surgery because they still go in to kind of look in the shoulder, but they didn't actually remove any of the tissues. So what they did was they just put some fluid in there, looked around, but they didn't actually remove any of the tissues, so the bone spur and bursa and all that kind of stuff were still intact. And then finally there was a no treatment group, which served as a control. And this group, no physical therapy, no injections, nothing. They had 1 appointment with a shoulder specialist at 3 months, but no treatment or anything like that. And the outcome of this study was that both the decompression group and the arthroscopy group both improved the shoulder pain, and there was actually no statistical difference between the 2 groups at 6 or 12 months after the surgery. But the kicker is that the no treatment group also improved. And while they didn't quite improve as much as both of the surgery groups, there was statistical difference between surgery and no surgery, but there wasn't a clinical significance between surgery and no surgery. The authors of the study concluded that while subacromial decompression or arthroscopy help decrease the shoulder pain, it doesn't seem to help give a clinical benefit to the patient, so whoever is having the surgery performed on them. And to further muddy the waters, they actually don't know if that difference was strictly due to the procedure or if it was due to the post-operative physical therapy, which could have helped improve the outcomes of the surgery. And this article adds to some of the other evidence that has looked at structural pathology and pain syndromes, in that pain syndromes and structural pathology don't seem to be as closely correlated as we think. So just because you have a bone spur or a disc herniation or even a meniscus tear doesn't mean you're going to have pain. There's a lot of asymptomatic people, so people without these structural pathologies that have no pain. And in fact, there was another study very similar to this one, but it was on the knee. And so what they did was, in one group that they would fix the meniscus tear, and in the other they would just do an arthroscopy but not actually touch or repair the meniscus, and they found that the outcomes were similar. All in all, the relationship between pain and structural pathology is complex. There are quite a few people who have a bone spur but no shoulder pain, and conversely there's quite a few people in a lot of shoulder pain and no bone spur. And that's not only true for bone spurs, but also true for rotator cuff tears, so either partial or full thickness tears, or even arthritis as well. It seems that bone spurs and other structural pathologies may be present when pain is present, but they have little to do with the actual production of pain. Therefore, when we look at treatment, these surgeries to remove a bone spur don't seem appropriate if the bone spur isn't actually the cause of pain. And so when we look at the treatment, the primary treatment still appears to be exercise, which can help strengthen everything in the shoulder and decrease the pain. And so the short answer to whether bone spurs are the reason for shoulder pain, and specifically shoulder impingement, the answer is probably no. Thank you guys for watching my video. Hopefully you found this information useful. If you did, please give this video a big thumbs up. And if you want to see more of my content, don't forget to subscribe to the channel. Otherwise, I'll see you in the next video.